for tuning in. And I'm Jaime, and I'm an ERP therapist and a CBT and EMDR therapist as well. Today we are thinking about, today we continue on our series of treatment of OCD and how OCD works. And today's video number 7, counting the first one from the introduction. So far we have talked about how treating OCD means letting go of the things you normally do to feel better in the short term. And on the surface, this works, and some of the behaviors seem to work in the short term. And we have sort of gone through a few videos now where actually in reality what it is happening is that the cycle of OCD continues. So we're going to expand today a bit more on that cycle. We have mentioned about intrusive thoughts. We can mention about intrusive urges, images, emotions. So we will use this within this cycle. And this is an invitation for you to explore your own cycle of OCD. Okay, we touched a bit last video. We'll touch again. So let's bear with me. I'm going to share my screen. Oh yeah. So we'll go through this cycle. So apologies for the bad handwriting. I'm having a bit of an issue with my wrist, so the drawing doesn't really come out as I wish it did. So what we're trying is to, let me move this here. What we're going to do is we're going to be first looking at the cycle, and we're going to go to the major things that people come to therapy, right? So what we want to be drawing in the middle, is sort of intrusion. Yeah, intrusion. Thought, image, urge, feeling, let's type. So the intrusion, let's type. We can have intrusion. That could be a thought, an image, an urge, an sensation, an emotion, as we have discussed before. Okay? So once we have that, what we look is at what are the meanings. So we start looking at what are the, as we said, the big 3 things: meanings, interpretation, response. So once we have this, we are going to assume that this intrusion comes up and that you know the meaning you are given and you know the interpretation you're given. So now what happens is the most common response we're going to be putting today are things like avoidance, are things like reassurance seeking, I'm sure there is another ones that they also relate to you. We're going for the main ones. Checking. So checking doors, checking things, checking your mind, checking. Another big one that we see often is washing, cleaning. Then we have approaching. So we avoid things, we stop doing things, and we approach things. So washing, checking, reassurance seeking would be approaching, would be things we try to solve. And some of the approaching effects would be more difficult, have a more impactful outcome that is unintended. So if you were to think an example, at some point someone was afraid of being assaulted and they had intrusive thoughts of being assaulted, and they were to carrying a weapon. So that made things difficult for treatment. So that would be other things that people approach, things you do to reduce the likelihood of this urge, of these emotions to do, right? To happen or to come to true. Okay. Now, another big one as well is mental compulsions. Mental compulsions. And the mental compulsions are, they take a lot of forms. So I'll be typing these to be easier. So mental compulsions would be try to stop, block the thoughts or urges, etc. Could be mantras, 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 prayers. Apologies if I'm spelling something wrong and so on. Replacing words that they have seen as bad, bad versus good words, repeating words, sort of sometimes we use imagery to let thoughts go, and that sometimes becomes an actual obsession. So people does it so often, so obsessively, that is reinforcing the thought. So things like letting thoughts go. What I notice in the years of practice is that there are things that come up and they come up again and again and again. There are variations, and that humans, and this is something I always tell the people I work with, humans are so creative, so creative. They're so resilient that they have managed to survive all this pain. All the pain that this causes, they have managed to survive it in the short term with all of this. And what happens is for years, as we've seen before, somehow this continues reinforcing or maintaining some of those meanings, interpretations, and the intrusions. Okay, so let me stop sharing my screen. So once again, what we're trying to figure out here, what we're saying is that the actual interaction, the way we uh, understand the thoughts as problematic, that's what is creating these compulsions, these sort of behaviors that ordering, throwing things away when you believe they're contaminated, short term, finding that comfort, long term, strengthening the cycle. So, again, we are trying to solve the problem that is an intrusion, and we discussed in earlier videos, where we are trying to reframe is that your brain is throwing thoughts, and what we can control are the way we respond, the way we interpret, and the way we meaning we give them. That's why the treatment focus is something different on exposure and response prevention, or ERP. This is where we gradually face fears, the thoughts, the images, the situations, the triggers that will bring those responses, that will be those responsive. And we practice not to do the compulsion. So we'll do it in a scale way, we'll do it repetitively, we do it focus, and over time, your brain will learn that you can handle the anxiety, the fear that comes with that, without trying to escape, and that the discomfort starts to fade away. Within that, we do other things to help people to manage some of the strong emotions. So here is some exercises you can try to do. So you can write down all the things you do, the inside, outside, to relieve your OCD. Then you can ask yourself, is this really helping me in the long term? Is this keeping me stuck in the present or in the thoughts? And notice how long you've been doing them. So get a timeline. Has it been months, years, and has the OCD changed? Has it felt better? Has it varied? Has what you're engaging solved it? Has it gone away? Right? Is these strategies solving and are they the ultimate solution, or they are sort of helping you in the short term to survive and help your brain to regulate. So the first thing what we do always is awareness. When you know, then you can do something about it around your patterns, and you're better prepared to practice ERP and take control of your OCD. So remember, OCD urges you to escape the discomfort, and the real change happens when you accept it and face it. I hope you enjoyed. Remember to drop a comment if you got a question. Remember to like us, share us, and hopefully you enjoyed this video, the ones before and the ones coming. Thank you.